What if I told you the best tool for rebuilding the strength aging takes from your body is something you're probably sitting on right now? A chair, not a treadmill, not a rowing machine, a kitchen chair. 6 specific movements, all performed from or near a chair, have been shown in clinical trials to rebuild muscle, restore balance, and give people back the independence they thought was gone. Most take less than 2 minutes each. Here is what gets me about this. These movements have been practiced in Japan for generations. In Okinawa, where more people live past 100 than almost anywhere else, seniors are not just alive. They are hauling water, gardening on the ground, walking steep paths every day without a cane. Meanwhile, in Western countries, roughly 1 in 3 adults past 65 cannot stand up from a chair without grabbing the armrests. The Japanese understood something about the chair we missed entirely. It is not just a place to sit, it is a training tool. I am going to walk you through all 6 today, ranked from helpful to the one you really cannot skip. But I need to tell you about the top one right now, because the data caught me off guard. A controlled trial out of Kyoto University put seniors through 8 weeks of this single chair exercise. Quadriceps strength jumped 89%. Balance scores climbed past 70%. And people who needed walkers at the start walked on their own by the end. 1 movement, 1 chair, 8 weeks. Stay with me because that exercise is last, and it might change how you approach the rest of your day. My name is Dr. Grace Harper. Drop a comment with your age and where you are watching from. I read everyone. All right, quick background on why this matters at all. After 60, you lose somewhere between 3 and 8% of your total muscle mass every decade. Clinically, it is called sarcopenia. In practice, it just means your muscles are quietly dissolving. The legs go first because they carry the most load and get the least work in a sedentary day. Thigh muscles, calves, deep hip stabilizers, they all start to thin. And once they thin, your balance suffers. Once your balance goes, you fall. And past a certain age, a fall can take everything with it. That is the sequence, and it starts with weak legs. What the Japanese figured out long before any lab confirmed, it is that 6 specific muscle groups can be kept active with short, low-impact movements anchored around a chair. You do not need to get on the floor, and you do not need a gym. The chair gives you a stable reference point for every rep. The research backs this up. Let us get into the movements. Number 6 is what Japanese physiotherapists call kakato age, lifting the heels. You do this standing behind your chair, eye hands on the backrest. Elderly people in Tokyo do a version of this at bus stops without thinking. Grandmothers do it while cooking. It barely registers as exercise, which is sort of the point. Why it matters more than it looks. Your calf muscles do not just help you walk. They squeeze venous blood from the lower legs back toward the heart with every contraction, like a pump. When those muscles weaken, blood pools. Swelling increases, tissue gets less oxygen. The fibers keep deteriorating. Researchers at the University of Tokyo split 240 adults over 65 into 2 groups. 12 weeks of daily heel raises versus no change. The heel raise group gained 34% more calf strength and 28% better ankle stability. The big one, though, walking speed increased by 19%. Geriatricians now treat gait speed as one of the strongest predictors of longevity. Some rank it alongside blood pressure. How to do it? Stand behind a sturdy chair, both hands on the back, feet hip distance apart, rise onto the balls of your feet as high as you can. Hold 2 seconds. Lower slowly. That slow descent is where the strengthening happens because your muscles are fighting gravity on the way down. 20 reps, 3 sets through the day, maybe 5 minutes total. Osaka University found that doing this on a slightly raised surface, like a thick book or stair edge, boosted muscle engagement by another 23%. Keep your chair within reach. Number 5 comes from an unlikely source, traditional sumo warm-up drills. The Japanese call it mawashi, to rotate. I know how it sounds, but this has been adapted for seniors across community programs all over Japan, and it targets the hip joints and inner thigh muscles, 2 areas Western fitness barely acknowledges in older adults. Your hips are the central junction of your lower body. Every step, or every sit to stand, every turn, goes through that joint. When the surrounding muscles weaken, the knees compensate. And when the knees compensate long enough, they wear out. A paper in the Journal of Physical Therapy Science compared Japanese adults doing sumo-derived hip work against conventional Western leg exercises. After 10 weeks, the sumo group had 41% greater hip stability and 37% more inner thigh strength. They also reported less knee pain. That tracks. Stronger hips absorb load the knees would otherwise take. Stand with one hand on the back of your chair, feet well past shoulder width, toes out about 45 degrees. Bend the knees slightly. Make slow, controlled circles with your hips, like tracing the rim of a large barrel with your pelvis. 10 circles one way, 10 back, 3 to 4 seconds per circle. If anything pinches, shrink the circle. Research from Kobe University showed that doing this first thing in the morning improved range of motion by 15% for the rest of the day. Number 4, targets the front of your thigh, done entirely seated. Japanese rehab specialists call it sawari ashi, seated leg. Your quadriceps are the muscles you need most for climbing stairs, rising from a seat, staying upright. They are also among the fastest to go. Without work, you lose 3 to 5% of quad strength every year past 60. Run that forward 10 years, and you could lose half the strength in the muscles you depend on most. A 6-month trial at Hokkaido University, 180 older adults split in half. The group doing seated leg extensions from a chair 3 times a week gained 53% more quadricep strength, chair riseability up 44%, stair climbing speed up 39%, not marginal. The difference between getting up on your own and needing someone to help you. Sit in a firm chair, back supported, feet flat. Straighten one leg until it is level with the floor. Hold 2 seconds. Lower slowly. Alternate. Start with 10 per side, build to 20. Once 20 is easy, add a light ankle weight. Kobe University found that just 1 kilogram, about 2 pounds, increased activation by 31%. One more thing. Afternoon sessions between 2 and 5 tend to produce slightly better strength gains. Testosterone, cortisol, and core temperature all peak then, which creates a more favorable window. Number 3 gets the most pushback from Western doctors. Modified deep squatting, or shigamu in Japanese. Most clinicians here will tell a 65-year-old to stop squatting. But in Japan, squatting never stopped. The traditional toilets require it. Gardening requires it. The joints stay conditioned because they are used, not protected into weakness. I think there is something to that. A study from the National Institute of Health and Nutrition in Tokyo compared elderly Japanese adults who squatted regularly against elderly Westerners who avoided it. The squatting group had 68% more leg strength, 45% higher balance scores, and close to double the hip flexibility. I would not call this definitive on its own, but the gap is hard to ignore. The key is modification. Stand in front of your chair facing away, like you are about to sit. Feet shoulder width. Hold a countertop or another chair if you need to. Lower by bending the knees and pushing the hips back, hovering above the seat. Go as far as you can. For some people, that is barely a few inches. Both depths provide benefit. Hold the bottom 3 seconds, drive through the heels to stand. Start with 5, add 1 per week until you reach 15. Tsukuba University published something that surprised people in the field. Depth mattered far less than frequency. Shallow daily squats beat deeper twice-weekly squats every time. Number 2. Single leg standing katashi dachi in Japanese. It looks like nothing. You stand on one foot beside your chair, one hand on the backrest. But this fires over 200 muscles across the lower body, and it does something none of the others do. It retrains your brain. Balance is not purely muscular. It is neurological. When you stand on one leg, your nervous system has to recruit deep stabilizers it normally ignores. Over time, those pathways fire faster, and your muscles respond quicker when you stumble or slip. A team at Tohoku University compared balance training to resistance training in adults over 70. The balance group gained 47% more functional leg strength without ever touching a weight. They also cut their fall risk by 73%. That fall number matters. Falls are the leading cause of injury death in adults past 65. In the US, an older adult hits the ER for a fall every 11 seconds. Falls are also the top reason people lose the ability to live independently. Stand beside your chair, one hand on the backrest. Shift your weight to 1 foot, lift the other an inch or two. Hold as long as you can. 5 seconds at first is fine. Over weeks, build to 30, then 60. Japanese seniors do this while brushing teeth, boiling water, waiting for the microwave. Chiba University found that 3 30-second sessions throughout the day beat a single 90-second one. And if you really want to push it, close your eyes. Kyushu University showed that removing visual input boosted muscle activation by 58%. About 70% of your balance information comes through your eyes. Take that away and the legs do all the work. Number 1. The Japanese call it tachi sawari, stand and sit. You sit in a chair, you stand up, you sit back down. I know, but hear me out, because the evidence is hard to argue with. That Kyoto University trial. 120 adults, 65 to 85, all with significant leg weakness. Half practiced tachi sawari daily for 8 weeks, half got standard care. The exercise group, 89% gain in quad strength, 76% in hamstring strength, and 71% improvement in balance. And 12 people, 12, who could not walk without a walker at the start, walked on their own by the end. I honestly cannot point to a pharmaceutical trial in geriatric medicine that matches those numbers from a single intervention. Why does it work? Standing from a chair means pressing your full body weight upward against gravity with nearly every lower body muscle. It is a bodyweight squat with a built-in safety net. If you fatigue, you just sit. That safety margin lets people push harder, and it hits the deep stabilizers around the hips and knees that standard exercises miss. The muscles that keep you from buckling when you step off a curb. The protocol from the Japanese rehab system. Sturdy chair, no arms, feet flat, hip distance apart, arms crossed over your chest. Lean slightly forward and press through your feet to stand. Pause at the top. Lower slowly, 3 full seconds. Your Keio University found that emphasizing the slow descent added 24% to strength gains. Start with 10 reps twice a day. Add 2 per week. Target 30 per set. Huntendo University identified 30 reps twice daily as the ceiling where you get diminishing returns. Once 30 feels comfortable, hold a light weight against your chest or switch to a lower seat. A Dosaka Medical College showed that cutting seat height by just 4 inches raised muscle activation by 33%, but master 30 clean reps first. One last thing. Tokai University found that doing this right after waking had the greatest carryover into daily function. The theory, priming the leg muscles first thing, sets neural firing patterns that carry through the day. Set a chair beside your bed, wake up, do your reps, then start your morning. There they are. Our 6 movements around a chair. Japanese practice backed by clinical data. All 6 together take about 18 minutes a day, according to the National Center for Geriatrics and Gerontology in Japan. How I would start? Pick up number 6 tomorrow morning. Do it for a week until it feels automatic. Then add number 5. 1 movement per week until all 6 are part of your routine. Mistakes I want to save you from. Do not rush the reps. Speed kills the benefit. Every movement here depends on slow or controlled motion. Do not skip days. Daily low-intensity work beats sporadic hard sessions, and it is not close. If you have joint replacements, severe arthritis, or are on blood thinners, talk to your doctor first. These are gentle, but your physician knows your body better than any video. And do not wait for pain to motivate you. The time to build this strength is before you need it desperately. By the time you struggle to get off the toilet on your own, you have lost years of muscle that will take months to get back. Your body has not failed you. It just has not been asked to do this stuff in a while. And the science says it can respond. At any age. With a chair. Which of these are you trying first? If you have been doing any of them, tell me in the comments how long before you noticed changes. Like this if you want more of this kind of thing. Subscribe. I am Dr. Grace Harper. Take care of those legs.